Good afternoon, and welcome to the July 9th Community Update. My name is Zone Pofu, and I serve as a Public Information Officer in the Emergency Operations Center. This community update is available in Spanish on the Buncombe County HHS Facebook page and at BCHHS. Today's update, we'll be hearing from Quentin Miller, Buncombe County Sheriff, Dr. William Hathaway, Chief Medical Officer for Mission Hospital, Dr. Jennifer Mullendor, Medical Director and Interim Public Health Director for Buncombe County, and then we'll hear from Captain Joe Silverman with the Asheville Police Department. To start off our briefing, we'll now give the floor to Sheriff Quentin Miller.
Thank you. First, let me say that COVID-19 is a serious public health issue. I hope that everyone in our community can work together to allow businesses to operate while keeping workers and community members safe and healthy. Wearing a mask is an essential part of keeping people safe from COVID-19. Wearing a mask is required to do business at any Buncombe County facility. Just yesterday, the Sheriff's Office received a call to the Buncombe County Planning Division due to someone refusing to wear a mask and refusing to leave. Ultimately, we were able to talk through the situation, and the individual did agree to put on a mask and was able to conduct their business. Private businesses also have the right to require that patrons wear a face covering. If an individual fails to comply after being asked by the business to put on the mask, they can be asked to leave and must comply or face being charged with trespassing by the Sheriff's Office. The goal of law enforcement is to educate and inform about what the executive order does and why it is important. We hope to achieve voluntary compliance and will engage in discussions with businesses prior to issuing citations. However, the Sheriff's Office will issue citations if need be. We know that business owners in our communities want to keep their workers and customers safe, and we're hopeful that by taking this approach, we can get voluntary compliance. Again, I ask each of you to please wear a mask in public for the safety of everyone in our community. Thank you.
Good afternoon. Jennifer Mullendor, Interim Health Director and Medical Director for Buncombe County. Lab-confirmed cases of COVID-19 in Buncombe County are rising at an alarming rate. Yesterday, we received nearly 50 new positive lab results, and so far today, another 42. Almost all of these cases are in individuals who do not live or work in long-term care facilities. Our communicable disease nurses continue to work long and hard to reach out to each of those individuals, to provide guidance on isolation, and to determine their close contacts in an effort to prevent further spread of the virus. As a result of the significant influx of cases and the way data must be manually entered to populate our county COVID-19 dashboard, there will be a fairly large lag in the case counts shown there. Therefore, today I will be sharing case count data from the state's COVID-19 dashboard. As of noon today, there have been 777 lab-confirmed cases of COVID-19 in Buncombe County residents. 32 of those individuals have died as a result of their infection, including 27 residents of 4 local long-term care facilities. As I've mentioned previously, we continue to see a greater percentage of lab-confirmed COVID-19 cases in people between the ages of 18 and 49. We need everyone of every age to take this pandemic seriously. Not doing so only contributes to the spread of infection and puts all of us at risk. Yesterday, the county was informed of a new COVID-19 outbreak in another long-term care facility in the county. A COVID-19 outbreak in a long-term care facility is defined as 2 or more lab-confirmed cases. This means that since the start of the COVID-19 pandemic, there have been outbreaks at 9 long-term care facilities in Buncombe County. Public health considers a long-term care facility COVID-19 outbreak over when it has been 28 days with no evidence of continued spread of COVID-19 within the facility. Thankfully, 2 facilities have had their outbreaks come to an end, so we are now at 7 active outbreaks in long-term care facilities in the county. More details on these outbreaks will be available on the state's COVID website tomorrow afternoon. Buncombe County Public Health is aware of over 18,400 COVID-19 tests that have been performed on residents of Buncombe County and staff who work in long-term care facilities in Buncombe County since the start of this pandemic response. The way we tell whether a rise in cases is because of increased spread in the population rather than as a result of performing more tests is by seeing how many tests are identifying infections. Looking at that percent of tests that are positive tells us whether lab-confirmed cases are increasing in comparison to the number of tests performed. In North Carolina as a whole, 9% of COVID-19 tests performed are coming back positive, and this percentage has been stable for the past several weeks. However, in Buncombe County, since last week, we have seen a greater percentage of tests come back positive for COVID-19. This indicates we are seeing more spread of the infection in the community. Last week, 2% of COVID tests on county residents came back positive for COVID, but we are now seeing 4% of tests come back positive. We must all take actions to protect ourselves and prevent further spread. It is up to each of us to keep ourselves, our families, our friends, our coworkers, and the most vulnerable in our community safe. If you meet any of the following criteria, we are recommending that you get tested for COVID-19. Anyone with symptoms of COVID-19, and those symptoms, which I'm sure you all can recite with me now, include fever, chills, cough, shortness of breath, fatigue, muscle or body aches, headache, sore throat, loss of taste or smell, congestion, runny nose, nausea, vomiting, and diarrhea. Anyone who's a close contact of a known positive case, whether or not you have symptoms. And people in the following groups who believe they may have been exposed to COVID-19, again, whether or not you have symptoms. So these would be people who live in or have regular contact with high-risk settings, like long-term care facilities, homeless shelters, correctional facilities, or migrant farm worker camps. People who are at high risk of severe illness, such as people over the age of 65 or those of any age with underlying health conditions. People from historically marginalized populations, so Black and Indigenous people and people of color. Healthcare workers or first responders. Frontline and essential workers, such as grocery store clerks, childcare workers, construction workers, food processing plant workers, who work in settings where social distancing is difficult to maintain. And people who attend mass gatherings of any type, particularly if they're in crowds or other situations where they can't practice effective social distancing. If your healthcare provider does not offer testing, contact one of the local urgent cares or clinics who does. The state website has a Find My Testing Place resource, with up-to-date information about testing sites across North Carolina. Buncombe County government and Western North Carolina Community Health Services will continue to offer COVID-19 testing at community-based sites throughout the county over the next 8 weeks. The next testing event will be this Sunday, July 12th, from 1:30 to 5:30 p.m. at AB Tech off Genevieve Circle in the Allied Health Building parking lot. And then next week, we will begin the third round of testing at the same sites as the prior weeks. So on Tuesday, July 14th, testing will be available in Swannanoa at the Ingalls parking lot off Highway 70. And Thursday, July 16th, testing will be available in Inca at the Buncombe County Sports Park. Again, at both the Swannanoa and Inca locations, testing will be offered to staff of our smaller congregate care facilities from 9:30 to 10:30 in the morning, and then open to the general public from 10:30 until 1:30 p.m. There is no out-of-pocket cost for testing at these community testing sites, but we do ask that if you have health insurance, including Medicaid or Medicare, you bring your insurance card with you so that insurance can be billed for the cost of the test. Due to recent increases in testing nationwide and supply chain issues at some labs, LabCorp and other large commercial labs have seen a significant increase in specimens being sent to them for testing. As a result, the time it is taking to get test results has increased significantly to 5 to 8 days. Anyone with a positive test result, meaning that they have COVID-19, will be contacted by a public health nurse as soon as possible. People who were seen at the community testing sites are able to get their results online through the LabCorp patient portal. And per LabCorp's website, test results will be delivered to that portal as soon as they are available. Individuals will need to register or sign into the portal at patient.labcorp.com. Registration does require entry of the last 4 digits of the person's social security number or a valid driver's license number for identity verification via text message or email. The virus that causes COVID-19 doesn't care who you are or what you believe. If given a chance, it will infect you and potentially make you sick. And even if you don't get sick, it will use you to multiply and spread to your loved ones, your coworkers, and those with whom you have close contact. Wearing a mask or a face covering is a simple but powerful action. One of the most important actions each of us can take to gain control over this virus. There's a lot of talk about freedom, including some people talking about their right to not wear a mask. And here's my response to that. Not wearing a mask and not keeping your physical distance from others gives the virus the freedom to spread, the freedom to infect you and those around you, the freedom to make some people very sick, and the freedom to kill. If you want to be free from this virus, we must all work together and follow these simple but powerful recommendations. Wear a mask, keep your physical distance from others, and wash your hands. Together, we can do this. I'll now turn it over to Dr. Bill Hathaway.
Thank you, Dr. Mullendore. I appreciate that. I'm Dr. Hathaway. I'm the Chief Medical Officer of Mission Health System in the North Carolina Division of HCA Healthcare, and I'd like to provide an update on what's happening in our health system with respect to the COVID virus. Before I do that, however, I would like to extend a sincere thanks and appreciation to Dr. Mullendore and her colleagues at the Health Department who've demonstrated tremendous leadership as we are entering what truly is just the beginning phases of our dealing with the COVID virus. The leadership has been greatly appreciated both by me personally and by all of us at Mission Health System, and we're grateful as she's assumed the dual roles of the medical director of the health department and the interim health department director. Mission Health System has seen a rise in cases. I don't think that should be surprising. We have seen a rise nationally. I'm sure all of you are aware of the rises in Texas and Arizona and Florida as examples, where with rapid reopening of the economy, they have seen an increase in both the absolute number of cases and in the number of hospitalizations, putting many health systems at risk for running out of resources to care for these patients. We in North Carolina have been fortunate that although we have seen a rise, that rise has not been as steep as it has been in other states. And we can attribute that in large part to our adherence to the social distancing measures that were implemented both at a county and a state level. Now is not the time, as Dr. Mullendore alluded to go back on those social distancing measures. We need to mind our 3 W's, wear a mask, wait 6 feet apart, and wash our hands so that our health system is not overwhelmed and that we can care for everyone in our community, whether they have COVID or non-COVID type illnesses. As Dr. Mullendore said, the state has now over 1,000 patients in hospital beds suffering from this virus. That is a significant and steady rise over the last 10 to 14 days. At Mission Health System, we have also seen a rise. We are at a peak of 27 patients hospitalized with the virus as of this morning, and 8 of those patients are in our intensive care units on ventilators. While these numbers are certainly increased from our previous numbers of about 15 to 20 on average per day over the last 10 to 14 days, they still are numbers that we can handle with respect to capacity at the health system. I don't, however, want to create a false sense of security by saying that. I think that, as Dr. Mullendore pointed out, we are at great risk for this virus taking off in our community, just as it has in other communities, both within the state and nationally. We have the opportunity to learn the lessons from those who have had much more impact of the virus in their communities, and I'm asking all of you who are watching today to help us as we try to stem this tide, and I believe we can do that. As Dr. Mullendore said, we are seeing an increased number of patients in the 18 to 49-year-old age group who have been infected with this virus. That is no doubt related to increased mobility among that segment of the population, not just over the recent holiday weekend, but in a variety of social and other settings. I think we can safely increase mobility to a minor degree as long as we continue to wear masks, stay apart from each other when we have to, and continually wash our hands and avoid touching surfaces that we don't need to touch. While most of the deaths that we've seen in our hospital have occurred in the older age group, and by that I mean above the age of 65, that is not the exclusive domain where we have seen deaths. And it is unfortunate that we have had a number of deaths in people younger than 50 years of age. And I raise that issue just to remind people that while we have emphasized in the past that the majority of patients do well with this illness, particularly those who are young, not everyone does well with this illness, and we aren't able to predict who will or won't acquire the illness and remain unscathed. Mission Health System remains at level 2 visitation. This is 1 visitor per family or per patient on a given day with some restricted hours. Details can be found on our website. And we continue to provide what we call non-COVID or non-essential care at this point in time. We are fully prepared and will escalate to level 3 visitation and restrict care for patients with non-COVID illnesses if the epidemic takes off in our community again. None of us want that. That would be bad for all of us in so many different ways. And I mention that to plead and emphasize with you the importance of helping us to stem the tide by wearing a face mask, waiting 6 feet apart, and washing your hands. Last but not least, we recognize the impact that this virus has had on the economic health of our community. We know that unemployment rates have risen considerably, and with that, many patients have lost their insurance status. It's very disappointing to all of us and unfortunate that that's the case. In response, we have created an insurance assistance program. The information on how to access this can be found at our website, missionhealth.org. If you go to the website, you'll see a red banner bar at the top where all of our COVID-19 resources can be found, and you'll be directed to the appropriate hotline where you can receive information on how to access COBRA Care, apply for Medicaid, obtain insurance through the health exchange, and a variety of other assistance programs. None of this is tied or obligated in any way to any relationship you have or don't have with Mission Health System. It's a community service which we're providing. Again, as I close, I want to thank you for what you've done. I want to encourage you all to do more. Masks are critically important. Face coverings and washing hands are at least as effective as a moderately effective vaccine. And while we wait for effective therapies and vaccines to be developed, we can do a lot to stem the tide. Thank you very much.
Thank you, Dr. Hathaway. I'm Captain Joe Silverman with the Asheville Police Department, and I'm joining today's community update to give an explanation of law enforcement's role when it comes to the enforcement of COVID-19 orders. Specifically, how we are responding to mask compliance at businesses. Since March, the Asheville Police Department has been strongly focused on education and advisement when it comes to the enforcement of COVID-19 orders. Only in cases of persistent non-compliant behavior have we considered the use of citation to gain compliance. Since March, we have received more than 300 calls for service related to violations of COVID-19 orders. Out of these calls, less than a handful resulted in citations. Many of these calls were resolved by communication. When it comes to the mask update, citations may be written to businesses or organizations that fail to enforce the requirement to wear face coverings. Operators of businesses and organizations are entitled to rely on their customers' or patrons' statements about whether or not they are exempted from face covering requirements. Businesses and organizations do not violate the order if they rely on such statements. Voluntary compliance and education are specifically encouraged under the executive order. However, if a citation is necessary, just like the enforcement of past orders, it would be a Class 2 misdemeanor. If a business or organization does not allow entry to a worker, customer, or patron because they refuse to wear a face covering, and that person persists to enter, the individual may be cited for trespassing or violating other laws. Non-compliance can be reported to the Asheville Police Department's non-emergency number at 828-252-1110. We recognize that this can be difficult. Just as we are discussing the importance of face covering to our residents right now, we as public servants continue to remind one another to wear masks. Staying healthy is a joint effort. We do know this is an incredibly stressful time for so many people, but please don't forget, together we will see it through. Thank you.
Thanks to all our contributors for today's update. As a reminder, Buncombe County Public Health and all of the Buncombe County Emergency Operations Team is committed to giving you creative and innovative ways to relay timely and reliable information about COVID-19 to all of our county's residents. In addition to these weekly updates, we also offer free bi-weekly webinars that we call Let's Talk COVID. During our next Let's Talk COVID webinar on July 14th at 1 p.m., we'll be changing the format slightly and having the forum completely in Spanish, although we welcome all of our English speakers to also tune into Facebook to hear the English. During this forum, we'll discuss contact tracing, the experience of our migrant farmers, as well as community resources, particularly for our Latinx community and neighbors. You can register for this webinar on the events section of Buncombe County Government's Facebook page. Also, want to share a reminder that the American Red Cross is now offering free antibody testing to everyone who donates blood. To make an appointment, visit redcross.org and scroll to the image that advertises the antibody testing with all donations. Type in your zip code and the website will direct you to a donation site near you. Also want to thank our American Sign Language interpreters as well as our simultaneous Spanish language interpreters who make today's inclusive messaging possible to all Buncombe County residents. Thank you also for tuning in to today's community update. We'll provide our next update on Thursday, July 16th at 2 p.m. Until next time, be well and stay safe. And again, a reminder for the 3 W's: wash, wear, and wait. Thank you.